Well,
Well, today we have Dr. Rao and Dr. Raoof. They both are practicing in Hyderabad, Telangana. We're going to be talking about BPH and OAB altogether because these both are very prominent and very important problem these days which needs to be discussed. Very welcome, sir.
thank you. As the aging population is increasing all over the world and also in our country, we are seeing more patients with BPH and also with associated overactive bladder. These patients with BPH have a lot of bothersome lower tract symptoms. They need to be given relief from these bothersome symptoms. Similarly, overactive bladder also can cause a lot of urgency and urgent continence. It's a very distressing symptom complex, and we have excellent antimuscarinic agents to address this problem.
Right.
Thank you.
Well, sir, would you like to add anything? We can talk about stones.
Stone disease.
Yes?
Yeah,
Yeah.
so look at that. Stones is quite common in India, especially in north and as well in Telangana as well.
Mm-hmm.
Usually they present with the probably the possibilities are basically the inadequate intake and bad eating habits.
Mm-hmm.
And they don't come to you until they have some problem like infection and pain and other things. Most of the things they land up with infection, especially with diabetes. Hyderabad being the main center for diabetes in the country,
Yes.
and especially in the whole world, India is leading the first one. So what we need to do is evaluate basically biochemically what is it which is producing that. Is it an obstructive or is it a basic problem within the system?
Mm-hmm.
So that we have to be aware of it. For that we need a couple of investigations where if we contact a concerned doctor then probably you can get the proper message.
Well, Dr. Raff, I would also like you to speak on what are the complications which might arise if the patient is delaying the process of getting diagnosed.
First, number one, normally when they present with this, there's the infection, sepsis. There's the worst thing. Usually it's the obstructive thing which gives them more trouble. And because of obstruction and diabetes on, they go in for sepsis. So you have to be very careful. Sometimes they end up in, until they get a renal failure, they don't turn up. That's the worst situation you can have.
So as early as possible.
As early as possible, better to get rid of. And smaller stones, they give more trouble. Bigger stones, they are quiet stones, and they are the people who go in for renal failures normally.
Right. Well, Dr. Rao, I would like to ask you, what complication can BPH give to the patient if they are not diagnosed?
BPH, number of problems they can arise, frequent urination, their quality of life suffers. They may ultimately go into acute urinary retention. They can develop recurrent urinary infections associated with burning, maturation, blood in the urine, all these complications. Therefore, all these conditions, if they are not corrected in time, they face a lot of problems. Even BPH, which is badly neglected, can go into kidney failure also.
Yes. Well, would like to ask you one more question, which is when is the time when the surgical interventions comes
There are
in?
definite criteria
Yeah.
for surgery. You can group all these patients into mild, moderate, and severe symptoms.
Yeah.
Nowadays, there are good medicines available, medical treatment available for mild and moderate disease. It's only the severe disease that requires surgical procedures.
Right.
Now we have
yes.
AUA grading as well,
Mhm.
1 to 10. If they're more than 5, then probably they're the candidates who have to go for procedures. And basically how frequently they get up in the nights, any hematuria or something, your total post-void volume, how much they are retaining.
Right.
Anything more than 50 is suggestive of obstruction.
Right, right. When talking in the same genre of kidney stone management, I would like you to tell our viewers that what precautions can a person take in order to avoid kidney stones, and of course in order to avoid the recurrent kidney stones.
Recurrent means the person, once you know that he has got the disease, we have got so many biochemical things which has to be checked whether they are in proper order or not. Then we have to balance the electrolytes and their food intake as well. That's the first thing. Second thing, most important is, especially in Hyderabad, eating habits are so bad, and especially non-veg.
Yeah.
Now, for example, I am vegetarian for the last 3 decades. my creatinine was going up, not because the stone disease, it was because the diabetes. Now it's perfectly normal.
Okay, so is it
That's
reversible?
He has
I'm
cut
telling
down all
myself my own
high
experience.
protein diet
High
and
protein diet I
non-vegetarian.
avoided now.
Yes.
It used to be around 1.8 to 2. Now my creatinine is normal, 1.2.
Wonderful, wonderful.
What he means is with proper diet,
Diet.
you can prevent
Control
some of
to
these diseases.
Complications.
Yeah, and for both BPH and kidney stone,
Yeah.
the diet and the modifications
Yes.
are same.
Both go together.
More so for
Both go
kidney
together.
stones, not
Yes.
more. BPH occurs is part of aging process.
But if are there anything which we can do as I'm talking about the males who are aged in on 40 to 50 years of barrier, and are there anything they can do to avoid it or maybe control it?
No. For benign prostate enlargement, there is no way you can control. It's part of aging.
Okay.
Therefore, everybody, when they reach the age of 80, 80% of people will develop the enlarged prostate. Therefore, there is no preventive measures. Only thing is you need to consult the doctor, follow the results, do preventive investigations like PSA to screen whether any malignant change in the prostate.
Right, right.
What I suggest basically,
Yes, sir.
everybody after 40 should get evaluated once in a year.
Right, right. In order to find any
That's
problem.
true.
Well, thank you so much, gentlemen.
Thank
It
you.
was very nice talking to you.
Thank you.
Thank you.